She is a board member of RSN, and she's also been working in the dialysis industry since 1993 in different capacities, taking care of people with kidney disease. She started as a dialysis technician, then became a nurse, and later transitioned to clinical coordinator of a hemodialysis unit, quality improvement professional, and case manager. While working full-time, Lana attended California State University, Northridge, and received a BS degree in nursing and a Master of Public Health and Education. She recently joined Kaiser Permanente of Southern California as a renal case manager. Lana and Lori Hartwell go back many years. She's contributed quite a bit to our website and our magazine, and she's been on many podcasts, and she's offered a wealth of information. And today we're excited because she's going to tell us what to do when you get the call, when you're on the transplant list and you get that call. What do you do? And I'm going to hand the microphone off to you, Lana.
Hi, everybody. It's so nice to be a part of this great meeting. Yeah, I mean, I grew up in nephrology and dialysis, so to speak. Next year is going to be 30 years working with kidney patients. And I know Lori for at least 25 of those years. So it's great. Right now, I work for Kaiser Permanente here in Southern California, and I oversee kidney transplant operations. So when Lori asked me to give a presentation, what to ask when you give a call, I just want to disclose that I don't work for the transplant center, but I did talk to somebody who does work in it for the transplant centers, and they gave me different scenarios and different questions, and most of them I'm already very comfortable talking about. Okay, so I have a few slides that I prepared for you, so I'm going to walk you through the slides, and after that we're going to have a questions and answer session. Hopefully that so if you do have questions during the presentation, please just write them down. We'll have plenty of time for the questions and answers. So I used UNOS website. UNOS is a United Network for Organ Sharing. It's a private nonprofit organization that maintains national wait list, and it's making sure that everybody has equal access to organs. Okay, so nobody can just buy their way ahead of others. And this information is from 2 days ago, literally as of 10/16. Right now, we have 105,703 people waiting for organs. And just recently, they have it on their website. They celebrated 1 million transplanted organs in the United States. I mean, I think that's a huge milestone if you think about it. So this organization became alive in 1984. And since then, they've been actually managing the distribution of organs. They're regulated by the federal government. And they work closely with the organ procurement organizations. So this is just generic information. In the United States, we have 11 regions for organ procurement, 11 regions for the transplant, right? And 57 organizations for the organ procurement. Here in the Los Angeles area where I live, we have One Legacy. This is our main organ procurement organization. And in San Diego, they're called Life Sharing something. I just looked at it right before the meeting. So some of you local people, some of you probably already heard about it, but we haven't, we haven't heard about, I mean, I don't know most of those organ procurement organizations, but I'm well familiar with One Legacy organization, because one time I remember years ago, I even visited the offices, and I was able to see how people are watching the displays of the local hospitals and how they're actually initiated conversations with patients' family members about possibly procuring, saving organs and donating organs. All right, so I assume that this is our most of us are kidney members or kidney patients or their family members or their loved ones. So now we're going to talk strictly about kidney transplant. And we have 11 UNOS regions. We have 57 organ procurement organizations. We have in the United States a little bit more than 250 transplant centers. And I'm well familiar, and I personally worked with at least 5 of them. It's UCLA, Cedars-Sinai, Loma Linda University here in Los Angeles area. And I know that they actually receive the organs from the same organ procurement organization. And in San Diego area, I personally worked with Scripps, Green, and UCSD, University of San Diego. So they get already organs from another organizations. And organs received from local OPO, it means within 250 miles, okay? Anything more than 250 miles are considered, if UCLA receives organ not from within 250 miles, it's called the national organ, okay? And also, I want to tell you that when it comes to the organs, when hospitals receive those organs for potential match patients, the pediatric patients receives priority as well as multiple organs. Patients who need, for example, heart kidney or liver kidney, okay? So those are the priorities, because when we talk about multiple organs, like 2 organs, for example, and one of them is kidney is considered a secondary organ. This is just for your general knowledge. And if you want to learn more about it, I put the website, unos.org. You can just visit that website. It has a lot of good information. And as a matter of fact, I used most of the information for this presentation from UNOS website, because the language is good. They explain everything very comprehensively. So I really, really like that website. So I recommend everybody visiting it. So if we are talking about kidney transplant, and I'm just out of curiosity, do we have most of our attendees who attend, most of them live in California, or we have from different states all over the US? Can somebody answer that question for me real quick?
We have people from all around, Lana.
All around, okay, because I can only intelligently speak of the wait list in Southern California. In here, people wait 7 to 11 years right now to receive a kidney transplant, while I'm aware that in other states it's still 3 to 5 years. But so hopefully those of you who are listening to this talk either considered kidney transplant, or this is just the first time for you learning, or maybe some of you already on the wait list. So let's say hypothetically the person is on the wait list already. Your team from the transplant center, they should tell you approximately how long you're gonna wait. And if we're talking about, let's say Lana is waiting for kidney transplant here in California, and I'm blood type O positive. The O positive, you know, more people born with this blood type, but we means that more people like me in need to receive a kidney or any other organ, or even blood transfusion with my blood type. That's why people with my blood type will wait for the longest. So let's say I need to wait for 11 years. So first of all, I need to keep myself healthy and prepare myself medically, which means if I'm on dialysis, I need to maintain my dialysis regimen. I need to go to my dialysis center 3 times a week. Or if I'm doing peritoneal dialysis or home hemodialysis, I really need to be organized and do everything that I need to stay healthy for these 10, 11 years. And hopefully once a year at least, my nephrologist needs to see me to make sure that I'm still a good candidate, okay? I also need to follow diet and exercise guidelines because I still want to be healthy when receiving transplant. Also, if I change the address or the phone number, I need to make sure that I will notify my transplant center and my healthcare team in my insurance. For example, or my dialysis center. So the transplant center team, for sure, they need to know all of my phone numbers and my caregivers' phone numbers. I need to complete medical tests and procedures on time. Some of the tests are only good for 1 year. For example, the blood work needs to be changed every year. If I did a colonoscopy, it's good for 5 years. If I did a cardiac study, it's good for 5 years. So hopefully this is something that the transplant center will explain to you, and you have a binder where you keep track of everything. You want to be current with your medication, with all of your tests. If I go to the hospital and get a blood transfusion or just hospitalized with any condition, transplant center needs to be aware of that, because the more blood transfusions every person has, the more sensitized they become. So they need to go through desensitization to receive a new organ, and to tell your body, so the body can accept this organ, okay? Also, if we're talking about, if I'm a childbearing age and I'm getting ready for a transplant, I also need to discuss contraception with my doctor and see if I'm planning to get pregnant sometime in the future. It's totally possible after getting transplant, but meanwhile, I need to discuss all these plans with my healthcare team. And of course, staying organized. So the next slide, I dedicated specifically on how to stay organized. So this is the tips on how to get organized. Definitely select a primary support person. If you are already on a wait list, you know that transplant center won't even consider you unless you tell them who's going to be taking care of you for the first 30 days. After transplant, that person needs to be with you every single day, 24/7, not just when you call them. Because once you come back from the hospital, somebody needs to help you with bathing, because you're going to be in pain, and you're going to be taking your pain medication, so definitely you won't be able to drive for at least 30 days. So that person hopefully will be the one taking you to all your appointments, and getting some chores for you, maybe doing grocery shopping for you, and pretty much laying their eyes on you every single day. Also, we highly recommend, UNOS highly recommends to organize your personal affairs. If you still don't have advanced directives, please do so. We don't, according to the, at least I work for Kaiser. So in Kaiser Permanente, we require everybody age 18 and over to have advanced directives. It doesn't matter if you're in good health or bad health. Basically, just hypothetically, what if you can hit by the bus, and what's going to happen? Who's going to be your decision maker? Who's going to make decisions on your behalf? Okay, it could be this document is actually, you can print it from the website, you can complete it, and even the third party, you don't have to, you can take it to the notary, but the third party who is not related to you can actually be a witness, and you can take this document to your healthcare provider. Financials, make sure that your finances are in order. The social workers probably can explain much better, but after the transplant, you need to have some funds available, because some of the anti-rejection medications are pretty expensive, and hopefully your healthcare plan will cover for all of that. But just in case, from what I've heard, at least, you have to have at least $3,000 to $4,000 in your bank account at the time of the transplant, because for the first months or so, you won't be able to work, and not sure about your sources of income. So just to be above the poverty line, you have to have those couple of $1,000s available. So then you have to consider the dependent care. And who are our dependents? It's children. Is it your elderly parents? Are those your pets? You have to think about all of them. Who's gonna take care of them when you are at the transplant center? You know, are they gonna stay at home with your spouse or with your children or with your sister, or you're gonna have to arrange the little hotel for your pets and make sure that your children are taken care of, your other family members? The transportation, when I'm talking about the transportation, it's not just caregiver driving you to and from appointments, but when you're on the top of the list, you already know that you're on the top of the list. Think about it. If a call comes at 3 in the morning, who is going to take you there? Are you going to drive by yourself? You probably could drive by yourself, but definitely driving back, it has to be someone else. Do you know where your transplant center is? Do you know where to park and how much it costs? So all of that takes into the play, because you will be given a time frame, but it's going to be a rather short time frame in which you need to make to the hospital. Also, what you're going to take with you, you know, you need to
Did Lana freeze?
I think so.
Yeah, I think
for
so.
maybe and something else. Also, what else to take to the hospital with you? Sorry, I'm getting the message that my internet connection is unstable, so I do apologize if I'm breaking up. You need to take your insurance information with you when you go there. You need to take a list of your current medications, even though if you get transplanted, your medications are going to be changed quite a bit. And take an extra 24-hour supply of your current medications, because you may stay in a hospital for a long time waiting for your surgery. And you know what? I don't want to be a bad news bearer, but sometimes the surgery may not happen because the surgical team may not know about quality of the kidney until the very, very last moment. So somebody from the transplant center told me this, and it totally makes sense to you. They said, you have to be a bridesmaid before you become a bride, right? So sometimes you have this dry run. When you go to the hospital, you know, you think you're going to get transplanted, but you may not. So you have to keep that in mind, because people get different kinds of emotions with that. And also, what you need to do, you have to educate yourself. Let's say if I'm waiting for 11 years for my kidney, and I'm still relatively young, I want to explore all other options that I may have, you know. And I'm a dialysis nurse. So I remember my patients, when they started on dialysis, a lot of them, if not all, they were quite depressed. That's why within 3 months, we want to do another assessment and talk to our patients. Are you still considering maybe a kidney transplant? And in about 3 months, most of the people, they think about it, oh, there is a life outside of dialysis. The first couple of weeks, I'm like, I lost control of my life. But here's 3 months mark, and people think, oh, you know what? I may consider something. I may need to connect to a support group. So yes, there are some support groups. Renal Support Network is one of them, but there are some local support groups. You can talk to your dialysis center, depending where you live. Your local ESRD network, they always have a patient services representative, and they can suggest a support group in your area where you live geographically. Also, with the transplant, you'll get new vocabulary. So you may want to go on UNO's website and start learning about it. Also, you know what? If you have family and friends, I know I've seen it a lot. A lot of people are very discreet and private and secretive about their condition, and they don't want other people know that they're on dialysis. But people will know anyway. So if you let your circle of friends and family and maybe your church people know that you are on dialysis, you never know what may transpire. I don't know if you guys heard what direct donation is, but it's like if somebody family member is already like in the hospital and about to die, if they have another family member or friend who is in need of an organ, they can explore it if they can actually take this kidney and give it to that person. But I have to tell you, that person in need has to be already evaluated and on the list waiting for the transplant. If they're just contemplating but the person was never evaluated, it may not happen, because evaluation has to be evaluation normally takes, it's a series of tests, it's a series of appointments in the transplant center. So if transplant center never seen you before, it's a 50-50 chance that the direct donation may not happen at that time. And never forget about living donation, because rather for me than waiting for 11 years, I want to explore it. I want to explore if somebody can give me a kidney. And either whether it's my family or my friend, or again, people in church, because you never know. Some people are very altruistic, and some people can wake up and think, oh, I want to donate kidney because I can fully survive with one kidney, but I want to save somebody's life and make this gift of life. So this educate yourself, meaning you're still on the list and waiting for disease donor kidney. But if you can explore living donation, go for it, because living donor kidneys, they last longer, and they're, it's literally they don't stay on the ice like disease donor kidney, and they start working right away, so the outcomes normally are better. Now here is a showtime. What happens when you actually receive the call? Okay. So you have to have your phone charged and with you at all times. And you have to accept all calls, unless it says potential spam. But I hope that by the time that you will be receiving the call, you already have some calls programmed in your phone. So you know whether it's area code or the phone number that starts, or you already have, that particular hospital is calling you. So you need to accept the call, because they will do all the reasonable attempts to contact you and your caregiver. But if they will not able to reach you, guess what's going to happen? Take a wild guess. They will go to a next person on the list. They will also ask you whether you experience cold, cough, fever, or other infection at that time. And you really need to be truthful about it. If you don't feel well, you need to tell them. I recently personally had a patient who went to the hospital and they tested him for COVID, and he was positive, even though he claims he was not having any symptoms, but he was positive, so he did not receive the kidney. Okay, so like I said, honesty is the best policy. If you don't feel good, tell them about it. But if you start receiving offers, it means even if the offer is not good for you, or you did not accept the offer, this means that you're on top of the list, and you will soon receive another call. Your team from that hospital, they will tell you the time frame to go to the hospital. If it's a local offer, they will probably ask you to be in a hospital within 2 to 3 hours. So of course, if you have your bag half packed, it will help you and save you some time.
Another gremlin. Can anybody put in the chat what were they doing when they received the call?
Shower or okay. They will also tell you that, oops, sorry, getting ahead of myself, taking certain medications. I'm not a doctor, but what I'm saying, it could be maybe a blood thinner, or something else. They will tell you, don't take that medication going forward. And what what else you need to do when you receive offer and you accept the offer? You definitely need to contact your support person. Hopefully this is someone who lives with you, or it's your relative, and don't ask me why, guys, but most of the calls come during the nighttime, during the holidays, and during the weekends. Only God knows why, but this is happening around those times. So if it's 3 in the morning on Saturday, Saturday early in the morning, still you need to call your support person and you need to let them know that you're going to be going to the hospital. And they should be showing there at some point, if maybe they should be the ones taking you to the hospital. Okay. What to wear? Whatever is comfortable clothing for you, and please don't bring any valuables with you, because especially like jewelries or something, leave it at home, please. So just a comfortable clothing, whether it's the suit of any kind that is easy to put on and take off. Okay, sweatshirt, sweatpants, something really, really comfortable. Okay, and once again, I want to make sure that you understand that not 100% of calls and trips to the hospital with a transplant will result in a transplant surgery. When the person who will be calling you, when they talk to you about the kidney, they will tell you KDPI score. Some of you probably know what it is, some probably don't. I want to tell you that it's a combination of factors, because people want to know a lot about, is it risky kidney? Was it a risky donor? Was donor having hepatitis or HIV or monkeypox? All this. So that KDPI index, it has all of this information in one bundle, and it will give you a percentage. So all you have to remember that the lower percentage or score is, the better quality of kidney is. Okay, just remember, the lower score, the better quality. Anything below score 85 is a good kidney. Anything above 85, it could be a little slightly higher, riskier kidney, but they will tell you exactly what you need to know. KDPI index includes like a risk index, and it based on 10 factors, and I'm going to read them to you. It's age, height, weight, history of diabetes and hypertension, creatinine, hepatitis C, status, ethnicity, cause of death, because there is a brain death and there is a cardiac CDC, so it's a cadaveric after cardiac death. So altogether, they will take it and they will give you the score. So again, the lower the score, the better quality of kidney is. So feel free to ask them, and they have to, by law, they will disclose it to you. They're not necessarily going to start disclosing you everything about this donor, but they will tell you a lot of information, or should I say just the minimum information for you to make intelligent decision. And if you're not comfortable, you can ask more questions about the donor and the quality of the kidney. So once you're in a hospital and hopefully you got a transplant, some of you have questions. How long am I going to stay in a hospital? Am I going to be there for 2 weeks or for 2 days? So from what I've seen over the years, the hospital stay for the kidney recipient varies anywhere between 3 and 8 days. Depending on how well you're recovering after surgery, okay? 3 to 8 days, sometimes could be longer if there are any complications. Also, your medication regimen will be changed. So they will prescribe a bunch of new medications, but they will take a bunch of old medications from you, from your list. So like hospital stay may vary, okay? Medications may vary, but they will teach you how to take it on what times of the day. Some of you will need to continue a couple of treatments of dialysis after you receive a transplant. That's not abnormal, so you know. So be ready. You know, some kidneys start working right away on the operation table, but some kidneys will still need a few days to wake up fully. So you just know that this is normal, okay? Also, very, very important to keep all of your post-transplant appointments, and that's why your caregiver is extremely important. And I've heard some stories from UCLA hospital and from other hospitals. The patient was already on the top of the list, but they had to put patient back on hold because at that time, patient did not have a stable caregiver. What a shame to wait for 10 years and then to be placed back on a wait list, on hold. So consider that the caregiver is very, very important. Also, after transplant, all people need to see dermatologist once a year, because your immunity is a little lower now because you're taking those anti-rejection drugs, and by fooling your body and telling your body that it's okay to keep this kidney, it's my baby now, your immunity is actually lower. So when you're under the sun, you may develop some skin conditions, and God forbid, skin cancer. So wearing sunscreen at all times and seeing dermatologist once a year is very, very important. And of course, a lot of people are asking, when can I drive again? You can drive in a couple of weeks, but you're going to be taking pain medications for at least 1 month after transplant. And you know, those pain medications, they may slow your not your thinking, but your reactions. So just to be on the safe side, it's recommended that you don't drive for the first 30 days and take a full advantage of having your designated caregiver do it for you. And also, it doesn't have to be caregiver that drives you all the time. It could be somebody else, a family member, who could take you to the appointment. Okay. And the last thing I wanted to mention to you before we go for questions and answer is just remember that transplant is a treatment for kidney disease. It's not a cure. It's not a fountain of youth. It's not a crystal ball. It's a hard work. It's gonna improve your quality of life 100%, but you need to work for it. And you really need to carry this transplant like a baby and take care of it like a baby. And now, I'm opening it to questions and answers.
Thank you, Lana. Let me take your screen sharing off so we can see your face.
Mm-hmm.
And I have a couple questions that I thought, or maybe we can wait till the chat. It's interesting because I think people's pain tolerance is different. And nowadays, with the pain medication restrictions, oh my goodness, I think people are having more pain now than ever. But the sooner you can switch to like Tylenol or something, because I can tell you guys, any of those type of opioids or anything like that, they cause other problems, and it can cause you to be really constipated to the point where it could really impact your health. Because it slows everything down. But I wanted to know, when you were in dialysis and you had a person in the center, and they got a call from a transplant. I mean, can you just tell a little bit about, as you being a longtime nephrology nurse, what that meant to you?
Some people go into state of fight or flight effect. Yeah, because it's exciting, and it's a good stress, but people don't know how to react, so it could be a good stress and they're like, oh, frozen, and some people start having like adrenaline rush and being super very excited. But one of the doctors told me that just try to be as calm as possible, because again, not every single call for the transplant will result in a transplant surgery. The better you're prepared, like we already mentioned, make sure they know all of your information, make sure they can actually call you and get hold of you, make sure that you have your bag packed, because if you're in a dialysis center receiving dialysis, this is like the best case scenario actually, because it means you're going to get to the hospital in a few hours and you're going to be dry and all the waste is out of your body. You're going to be ready for that transplant. But if you, let's say you're Tuesday, Thursday, Saturday patient and you receive the call on Monday morning, there is a good chance that they need to dialyze in a hospital before they will transplant that kidney inside of you, because they want you to be in the best shape possible for you. And depending on your conditions and depending on your labs, the doctors will make that decision.
Well, and you know, oftentimes people need to be dialyzed because they check their potassium level.
Yep.
And that's what they're most worried about, in addition to fluid, because you don't want extra fluid on you. But your potassium level just because nobody wants to say, oh, I got called, I'm getting a transplant, you need another dialysis treatment. It's a little bit of like, really? No, I thought it was going to be easy. And sadly, after you get a transplant, you know, you sometimes need dialysis. And it's not, it's just, you know, don't freak out about it. Sometimes I needed dialysis for 3 weeks with my third kidney. And, you know, I just needed to have it. And then the kidney kicked in. It was very scary though, for those 3 weeks and the kidney not working. And I remember when I got the call for my third kidney, because I was camping in Big Bear with my 2 girlfriends. We were at like one of those camps. They were so nervous, Lana, that I'm like, oh, I've done this before. I can drive. I was fine, but then once I get there, then I fall apart. You know what I mean? Like I can put it together. So it's really funny how we react to things. But thank you so much, Lana, for your presentation. You're such a dedicated healthcare professional, and I remember us meeting in the mid-90s. So you're one of my longest kidney kin healthcare professional family members.
Absolutely. I saw some questions popped in the chat. I don't know if somebody's monitoring chat. Can you guys read it?
We didn't have any in the chat. There was one about that you answered already. And I think the most important thing is to have a discussion with your healthcare team, because you know they're using kidneys that they have to label a little bit more of an extended criteria. I mean, if there's like an opioid overdose, it might get, but you know, don't turn down a kidney just because of that. Really understand what it means, because
I can actually comment on that, Lori. Because of this opioid crisis, we have a lot of organs that but think about it, those are younger people. Those are younger donors, and if they OD'd on an opioid, even if they had hepatitis C, it is a still good kidney because it comes from a younger person. And even if the person had hepatitis C, right now there is very sophisticated treatments for hepatitis C that for just 8 to 12 weeks you take medication and you're free from hepatitis C. So you can ask your medical team more about it, but yes, that's a very good point. Don't turn those risky kidney just because of the risky behavior. But if it was a younger donor, that's already a big plus.
Well, and it is, it's, you know, it's so sad that we have this opioid epidemic going on that, you know, it was kind of a sick joke, Lana, but we even would talk about, oh, you know, the helmet law is really hurt organ transplant, you know, which is, you know, a horrible joke, but it is a kidney joke. Whenever I see a motorcycle go by, I'm like, I hope they're a donor. So it's really quite interesting how people make choices, and but you have to be informed. You need to talk to your transplant center about if a kidney has a higher score of any kind, to really understand the risks and benefits of it, because it might be the perfect kidney for you. So thank you, Lana, so much. We're gonna bring on our next speaker here.
and a shout out to our corporate mission partners for making this happen.